Hi friends, today I am talking about transfusion medicine, its scope and applications. So people are not that much familiar about this department, transfusion medicine. So people think transfusion medicine is equal to blood bank. Actually, now the term blood center is using for blood bank. So people think what they think is blood bank means just get the blood from the donors and give to the patients. But it's not the exactly. But this is the major part of the blood banking. But this is not exactly happening in transfusion medicine. So I'll be telling about what is transfusion medicine in briefly in next upcoming slides. So this is our blood center. This is my blood center where I am working, and you can see donate blood, save life, which is an important part. That is a very important part. People are coming as donors, voluntary donors, and family donors like that. And we have other than blood banking. You can see this picture. This is called apheresis for single donor apheresis platelet (STP platelets). I will come to that. So people think in blood banking what usually will happen, blood grouping and cross matching like that. In blood grouping only we have slide method, we have tube method, we have gel card method, like that. Three different methods we are following, and there are advanced methods as well. And in majority of the peripheral blood banks or peripheral setup, they are using the old method like slide method or tile method. This having very low sensitivity, and it cannot be detect the discrepancy in the blood group as well. So come to blood bank or transfusion medicine. What is there? So in transfusion medicine, typically we are working with blood banking. Mainly we are working with blood banking, which is the backbone. Each medical college or each hospital have its own blood bank. Blood bank is the backbone of that institute. We can say like that. Without blood bank, it's very difficult to work. So other than blood banking, what are happening? There is immunohematology workups. You maybe heard about autoimmune hemolytic anemias or anti-D like RS negative pregnancy like that. There are many immunohematology workups are happening in our transfusion medicine department. And main part is apheresis. In apheresis, what we are doing, we are preparing the STP platelets. Along with that, in apheresis, we can do plasma exchange, stem cell transplantation like that. And plasma exchange, we know some autoimmune diseases like Guillain-Barré syndrome, myasthenia gravis, TTP, and Goodpatcher syndrome. There will be antibodies, so we have to give the fresh frozen plasma, and we have to exchange the plasma. This is procedure called a plasma exchange. And we know next the core concept of blood bank is developing new advanced technologies and tests like stem cell transplantation. This procedure, stem cell transplantation, is a vital procedure in the hemato-oncology cases. And clinical hematology and hemato-oncology, we are working on this clinical hematology and hemato-oncology. And advances in hematology and transfusion, there are many advances in transfusion. As we have autologous donation, we have freezing, we have regeneration, blood farming, and RBC substitutes like that. So these advances in immunohematology, hematology, blood banking, and advances in TTA screening, instead of CLIA machine, we are getting NAT machine like that. There are many advances happening every year. So these advances also giving a positive aspect to the department. So as I said, there is one procedure called apheresis. This machine we can do for STP procedure, we can do for plasma exchange procedure, we can do for stem cell transplantation. This picture here, the donor is me myself. I gave single donor platelet STP to a critically ill patient recently. So this procedure is a very important procedure. There are many advantages for this kind of procedures, and the patients critically needed this kind of products and this kind of advancement in treatment. And next to this, you can see this is a component separator. You can see, we can say a donor comes, he'll give a blood bag. Okay, it will be a 450 ml or a 350 ml. In peripheries, we are giving whole blood to the patient, but from the blood bag we can prepare PRBC, packed RBC. We can prepare the RDP platelet, we can prepare, and we can prepare FFP. From a single bag we can prepare three components, which is important for targeted therapy in blood management. So some patient only require plasma, some patient only require platelet. So from the whole blood we can prepare these three units. So one blood can save three lives. So coming to this, So what are the immunohematology workups which are happening in our department? Mainly we have direct cum test which can differentiate autoimmune hemolytic anemias. We have direct home test, monospecific tests are there, polyspecific tests are there. So we can differentiate AHA. There are warm AHA, there are cold AHA. The treatment will be different for individual things. So we can find this kind of autoantibodies, alloantibodies by doing indirect cum test, ICT, indirect cum test, so that we can identify the alloantibodies or the autoantibodies. And antibody screening, we have to screen the antibody whenever we are doing cross match. When it is come incompatible, we can't give that blood back to the patients. So what we have to do, we have to do cross matching with patients serum with the blood bag cells. So in that case, if it is come incompatible, we have to screen what kind of antibodies developed in the patient's serum, so that we have to give that cross matching properly. We have to get the proper unit, and we have to transfuse to the patient to save the patient. And one other procedure is antibody titration, especially in anti-D cases, in Rh negative cases. We are doing titration, and we have to know where is the critical titer. According to that, the treatment plan will change. Okay, and the last thing we are doing is phenotyping. Phenotyping means we will phenotype the exact. For example, in Rh system, we have 5 types of genes: C, small c, capital D, capital E, small e. If the patient we phenotype, we can understand whether the patient is capital C or small c. We have to give phenotypically matched, cross-matched fit units to the patients. So that this is also very important in blood banking or immunohematology workups. So you can see we can do cross matching when we can do ICT DCT test, groupings are doing, and we can see these are the tests. Few tests are done in the gel card method, and you can see this is a antigram. This is used for the identification of the antibody, unknown antibody. So we'll have select cells, we'll do the test, and we'll see which antibody will be eliminated, which antibody will be included. So finally we'll arrive at conclusion that this antibody is present in patient serum. So we can't give donor cells with that antigen. If you are giving that antigen, there is agglutination reaction, it will cause transfusion reaction, and after that any transfusion reaction happens also, we are doing workup, transfusion reaction workups, and that advisors will give. If it is not compatible bags are there, we will give least incompatible bags, so that the patient will get blood. In that time we will give proper instructions to how to transfuse, what you have to do prior to that situations. So like that, there are many things in immunohematology, blood banking. It's a wide subject like that. So come to the infrastructure. The main area is our blood donor area, where their donations happen, therapeutic phlebotomy happens like that. So mainly here, blood donations happen and therapeutic phlebotomy happens here. And we have, after donation, we'll take this bag, we'll store it, and we'll do the component storage and component preparation. So we have separately component preparation from the blood bag. We are preparing PRBC, FFP, cryo, and these RDPs like that. So in that we have another area called red cell serology lab, where there is all this immunohematology workup, blood banking, blood grouping, and these immunohematology workups happen there. So here in red cell serology, we know we have immunohematology workup, blood grouping happens, cross matching happens. This kind of red cell serology workups happens in red cell serology lab. We have TTI lab known as transfusion transmitted infection lab, where we are screening for HIV, hepatitis B, hepatitis C, syphilis, and malaria, this kind of infection which are spread through the blood what we are giving to the patient. And we have the apheresis room, where there mainly the procedures like apheresis will happen, STP, single donor procedure apheresis, plasma exchange can be done, and therapeutic stem cell transplantation, autologous stem cell transplantation, therapeutic plasma exchange, and this kind of procedure, advanced procedure, will happen in either apheresis room or in the ICU setup, where there we can use this machine for this plasma exchange or stem cell transplantation like that. So these are the main infrastructure and main things in the blood bank or transfusion medicine department. So what are the advantages of a department like this? So the main advantage is this is an emerging branch. This is an emerging branch. This branch is already established years back, and now there is scope for this branch. There is tremendous increasing rise of scope for this branch. So as an emerging brand, we have secured job. In all institute they are developing transfusion medicine department, and currently in India there are lack of so many senior residents or faculties for this branch. So we are lacking men or doctors in this department. So as you know, this is a moderate workload subject. Here workload will be moderate. Don't think blood bank no work. There will be work. There will be immunohematology work, follow up works. In clinicals also, you have to go to the ward, you have to do follow up. Sometimes you have to discuss with the hemato-oncology, you have to plan for treatment. This is also very important, clinically important branch. Okay, and this is actually compared to many other subject, this is a easy subject. What we can say, this is an easy subject. The subject is easy, and there are few books for the subjects, and there are many international books for the subject as well. And main thing is very good atmosphere for to work. We have very good technical support to work. Okay, and the main one is there is good payment even in your PG time or after PG. There are very good scope, and the payment will be very high. And this is a branch where you have a moderate workload and have a good payment with a beautiful atmosphere. So come to the future scope of this transition medicine. You can see like this graph. Now this is going up. The scope is going up. We need transfusion medicine people or transfusion medicine doctors all over India. We want to get job into many medical colleges. As you know, this is establishing in every medical college or every central institute. This branch is establishing one of the most emerging branch in India now. What are the scope for this job? As I said, we have consultant job availabilities as SR, assistant associate professors or professors in each medical college or the new institutes where these branches are establishing. And after this MD, it is enough to settle for your lifetime. But still there are further studies you can do, like fellowships. There are fellowships you can do, like fellowships in immunohematology, fellowships in hemato-oncology, fellowship in therapeutic apheresis, and fellowship in transplant immunology. And this will become most trending soon, and you will be very much settled future like that. And more than that, you can become a scientific advisor to some companies, like for example blood bank preparing company like Mitra, and NAT machine related companies, and plasma fractionation companies, and like that. And you can become blood bank officers in majority of institutions or outside places, and as well as example like Red Cross Society, like that. You can become blood bank officers, and the scope in foreign countries as well. So as I said, this much wide scope is there for this department, one of the emerging department with moderate workload and easy atmosphere. And actually work will be there, and it is connecting both clinical, preclinical, and paraclinical. Please, you just watch the video. If you understand about transition medicine, any doubt is there, put a message as a comment in the YouTube channel, or please share to me. My number I am giving is 7907144125. Put a WhatsApp message in this number so that I can reply to you. And thank you for watching this video. I think majority of the doubts will be cleared after watching this video about transition medicine. Thank you.